Welcome back to Your Palm Beach Guide, the podcast that brings you the conversations with the innovators, leaders, and changemakers shaping our community. Today, we're thrilled to welcome Krysta Fuoco, CEO of CDRx Pharmacy and one of the 2026 co-chairs of the Palm Beach Chambers Healthcare Council. Krysta is at the forefront of transforming how personalized care, patient empowerment, and community-centered healthcare come together. From redefining what a modern pharmacy can be to helping guide the strategic direction of our healthcare council, her insight and leadership have already made a remarkable impact. In this episode, we'll explore the vision behind CDRx, the importance of accessible and proactive healthcare, and what Krysta sees ahead for our local medical landscape. Let's jump in. Hello, Krysta. Good morning.
Good morning.
How are you?
Wonderful.
Thank you for being on today and being on with me instead of Dougie. So just thank you for joining us.
I'm excited. It's the morning of the girls.
I love it, right? We're going to talk and enjoy. So we're going to jump right in, though, just because I want people to really kind of get an idea of who you are and how you started. So can you just give a quick summary? Are you local? Are you from Palm Beach, from Boca? Where?
Yes. So CDRx Pharmacy, we're a compounding pharmacy and we're located in Boca Raton, Florida. Although we do service the entire state as well as 22 additional states.
Oh my goodness. And I know that you've played a pivotal role in shaping the growth of CDRx Pharmacy. So kind of walk me through your start of how you got involved and where you've taken it. Cause it's just, I mean, kudos to you. You've just launched it off of everything. So congrats.
It's such a fun story and it seems like it happened overnight. And then when I tell the story, I'm like, wow, this did take a lot of hard work.
Yeah.
So actually Compounding Docs was the original name and they started in Boca Raton in 2004. So
Okay.
we were born and bred compounding, kind of before everybody knew about it. And so we're really truly doing what we were born to do. We're now CDRx. And so the journey was that in 2020, we were introduced to this organization, actually through my husband.
Okay.
And so they were kind of like most businesses are, they were kind of at a pivotal moment where they either needed to look to kind of move on to their next steps. There were two private owners, or they wanted something bigger and better and they didn't have the resources to do it.
Right.
And so my husband and his partner group came in and they said, hey, we'll make that investment. Let's really kind of take it to the next level and see what we could do.
Okay.
And so it kind of started there and I wasn't in the mix of that conversation. I had just had my daughter.
Right.
I was like, nope, I'm going to sit this one out.
Yeah.
Good luck. I
Good
wish you
luck.
all the best. So clearly 2020 COVID,
Yeah.
I became for the first time like a stay-at-home mom with two little kids.
Right. And what are the age differences again?
So my son is 10 and my daughter is 6.
Okay.
So at that time they were 1 and 4.
Yeah.
Not even barely 1.
Mhm.
And so by September, October, I was crawling the walls.
Right.
And he was like, hey, the pharmacy could really use, some marketing and some help. Let's, and I said, okay, I'll be more than happy to. And I walked in the door and I was so excited at the opportunity that I saw.
Right.
But I just knew that this wasn't what it needed to be to achieve the greatness that it really could, to maximize all that potential.
And can you explain, for those who don't know, what is compounding?
Sure. So compounding pharmacy is different than your traditional, like what we would see down in South Florida, CVS, Walgreens, things like that.
Okay.
Compounding, we think more of labs, like a hospital facility. So we have 7 different labs in our facility and we actually make the medicine. And it's done for a multitude of reasons, either for a strength issue. So maybe you're so tired of cutting your tablets in half. And so you just want us to make you that dose, say, instead of you're getting it in 50, it's not available commercially in 25. We're able to do that for you. There's a multitude of different reasons why you would go to a compounding pharmacy, but for the most part, it's the dosing, it's how the deliverable. So if you are adverse to a pill or a capsule or you have an issue
With taking it.
we can change that for you.
Okay.
And then we also do a lot in the world of allergies. So if you have a gluten intolerance, if you're allergic to penicillin, any of those type of allergies across the gamut, peds to geriatrics, we're able to kind of change that medicine. It's really custom personalized
That's
medicine.
awesome.
Yeah.
Well, and I just remember when we visited your facility, you really do have a lab there, and we got to walk and see, and it was like white coats, and it was awesome.
Yeah.
Like,
It's very cool and it's unassuming. You
yeah.
walk in, we have this great lobby, everybody's very friendly. But then you kind of go behind. I always say like this is where the
Mhm.
magic happens.
Right.
And it's a state-of-the-art facility. So our accreditations is bar none. So we're really big on quality in our customer
Mhm.
service. And that you see that really in our labs.
And when you walked into those doors initially and you saw that opportunity, what was like stirring inside you? You were just like, I can take this on and I know that I will be successful. Like you had that confidence.
I did, which is
Yeah.
probably a little,
No,
aggressive.
it's not. That's what
G
successful is.
stepping into an industry, but I saw I had a vision for what
Mhm.
compounding docs could be, and I said, "Change is hard. I get it. It's really hard."
Right.
But being in healthcare, so I had to learn. I had to learn a lot, and I absorbed so much in the first
Mhm.
18 months, and I really had to gain a lot of trust and
Right.
develop a lot of relationships, with people, and unfortunately, we had to have a really big turnover happen.
It happens in all companies though. It
Exactly.
happens in all
And
companies.
we still are very friendly with a lot of those people. We
Right.
just weren't going in the same direction.
Right.
And so once I really learned the in and outs of compounding pharmacy, I
Mhm.
continue to learn every single day. But once I realized and I say like what CDRX wanted to be when we grew up,
Yeah,
and we kind of set those goals, and I have the most amazing team
you really
around
do.
me. We could not do what we do every day if it wasn't for every single person. We are like a lean and mean team,
Mhm.
but we all have each other's backs, and they really carried me through. They kept me. They were like, "We could do this. We could do this." And
Yeah.
I would throw out these outlandish goals or,
Right.
strategies, and they would look at me like I had 7 heads, and I'm like, "No, we're gonna do this."
Right.
And so we're wrapping up 2025, and I'm literally leaving here today, and I'm
Mhm.
going to a luncheon, and we're talking about all those crazy things that Krista said
Right.
because 'cause we've done them. We've accomplished it.
And I think that just gives your team a confidence in you as their leader to know that you built a culture that supports each other. And I think that's really important, especially in today's world. So,
Culture is everything.
yeah.
Healthcare is really intimate. Um,
Right.
I need everybody in my office to be happy because when they're on the phone, whether it's with a provider, anybody in the healthcare
Mm,
industry, or even a patient,
right.
you can hear whether somebody is happy or not on the phone. You
Yeah.
can feel it. And so, we're tiny, but we're mighty, but every single person that's there is happy to be there. And I tell them every day, I'll stop coming in when it's not fun anymore. And
Yeah.
then I can't expect anybody else to come in. And I wake up every morning going, okay, let's go to work.
Yeah, like let's get ready.
Yes.
Awesome. Well, let's transition back to specifically on pharmacy step focus. So, you're known for prioritizing personalized care. So, what sets your model apart from traditional pharmacies and how do you see the role of clinical pharmacy evolving in the next few years?
So again, going back to compounding is very personalized.
Mhm.
The medicine is made specifically for you,
Right.
where traditionally in like a CVS, you're seeing large bottles of pills. They're being dispensed in 30, 60, 90, and you walk out the door.
Right.
Compounding, we actually are making it. We are making the dosing for you. We're making the deliverable for you. But what sets CDRX apart is that we really become an amazing partner and resource to your provider.
Mhm.
We want the goal for your provider. Typically, we find ourselves in the longevity, functional health space.
Right.
We're big in dermatology, but we're seeing a lot of patients kind of taking their healthcare into their own. They're saying, "This is what I want to do,"
Right.
and they're finding practitioners that match that. We're able to develop these amazing relationships with the practitioners and make sure that the doctors that we're seeing through what the doctor wants for the patient
Oh, that's
and the
amazing.
patient's happy as well. And so it's this amazing relationship. 9 out of 10 times, a script isn't going to come from you walking in the door and saying, "Hey, my doctor just sent this." We have these amazing relationships with these physicians locally and all throughout the country.
Right.
And they know the quality of our product, they know our customer service, and then turnaround is really big. Our turnaround time is very quick.
That's amazing that you're working directly with the practitioner. And like that's a I we forget sometimes that healthcare is all encompassing,
Yes.
and there are so many different lanes sometimes that I think makes it difficult for people to access this.
Sure.
So just the fact that your pharmacy is working directly with like my doctor and I don't have to worry about it. It's like
Mm.
I know the quality is going to be there and I know it's going to be quick.
And my
So,
pharmacists are talking to your doctors. They're checking
mm,
everything. It's not just looking and saying, okay, your date of birth's right. We have that in stock. Your insurance cleared and you're out the
and you're out the
door.
door, right?
This is really, we're really looking at it and going, okay, this is the doctor. This is who sent it in. This is the patient. And we're questioning. We're
Hmm.
looking for the wrong. Why this dose? Why this type? Why this, therapy? And 9 out of 10 times we've already had conversations with these physicians. So we kind of know
Yeah,
their train of thoughts. And
right.
the really at the end of the day, the goal is that the patient is so happy in their healthcare.
Oh, that's wonderful. So now let's talk about the Healthcare Council for the new year.
Yes.
So you're not only a co-chair, but also the title sponsor for the 2026 New Year. So as we talk about this, what healthcare shifts or challenges do you believe business leaders and a consumer should be paying close attention to in this new year?
So healthcare is changing. We've seen it. And
Mm,
I will say it really started to change in 2020 and it's
yeah,
continuing to evolve very quickly. So not only do you have the patient being much more vocal in terms of taking their healthcare into their own hands and
right.
running with it, we also have AI. AI is coming into healthcare aggressively. We've seen the explosion of telehealth.
Mm-hmm.
And there's good and bad in all of this.
Right.
But what I'm excited most about, and especially for CDRx, is we really feel that we have the ability to be a very proactive part of that change that's happening in healthcare today. The goal is not for us to just put a band-aid on it and you
Right.
stay sick and we're just giving you a
Yeah.
medication to treat the symptom. We want you to live your best quality of life. And we want you to be proactive in your healthcare. And so we're finding that that's where those are the conversations that we're having in the healthcare community, both with the patients and the practitioners. And so we're excited because we're able to be a part of that. And
Yeah.
that's exactly what we stand for.
And are you seeing too, like a lot of your clients and people who, aren't in the healthcare profession, like you just said, take a real interest in what's going on in their own bodies for their kids' bodies. And then of course they're asking the questions, well, what about my parents? Like it's really kind of sparks this whole conversation of our health system and really Western health and the whole family tree,
Absolutely.
really.
I mean, you can't turn on the news or the radio today and go 2 minutes without hearing something
Yeah,
related to a shift in healthcare. And what's amazing is that these drugs are out there. These therapies are out there. The practitioners that want you to stay healthy, not sick, are out there.
right.
And there's tools for you to do that. Now the patients are asking the questions
Mm,
and they're coming in with knowledge. Where before they were coming in and they were a little intimidated and they would say, "Oh, well my friend told me, my
right.
neighbor's on this, my sister-in-law's here." Now they're coming in and they're saying, "Oh, no, no. I heard. I did my research,"
Yeah.
because it's all out there. I mean,
It is all out there, and I think that's, there's always a double-edged sword, but I think the good part just about all of this knowledge is that we're really taking the time to learn and understand, whereas, like my grandparents and our parents before them, they were like, "Whatever the doctor says,
yes,
I trust the doctor," which is fine,
absolutely.
but if you're constantly getting pills added to your regimen,
Right.
there should be a question there.
Absolutely, absolutely. And, you used to go in for your physical once a year, you'd get your blood work
Right,
done, and they'd say, "Okay, everything looks great. Maybe your cholesterol went up, you need to lose 5 pounds, or maybe
right,
you did lose 20 pounds and everything's good, but,
right.
you need a little bit of this cholesterol, blood pressure, whatever." Now people are going, "Oh, no, no, no. It's much deeper. It's
Yeah.
much deeper and it's evolved so much." It'll be amazing at what is to come in 2026. And I think that the patients and the providers alike
Mhm.
are really gonna find themselves for the first time on the same page.
Which will be good because then it's just working in harmony. You're not working
Yes,
against each other.
absolutely.
Yeah. I like that focus into the new year. So your leadership style emphasizes collaboration across all healthcare systems, providers and patients. How has partnership shaped the success of CDRX?
So we're really big. We see ourselves to some degree as an extension
Mhm.
of the doctor's office. If the patient's happy, the doctor's happy.
Right.
And what's critical in that and what kind of stands out to CDRX is that, so first and foremost is a patient has the right to go to any pharmacy.
Right.
There's no, we by law A doctor cannot say you have to go to this pharmacy. And by law, we cannot tell a patient, we have to fill this for you. They have the right to take it anywhere.
Right.
But what makes CDR, we're human.
Right.
You're going to call and you're going to speak to a person. We're going to know your name. We're
Mm.
going to start having conversations with you. And then when you do find yourself in that time of need, guess what? You're going to call us and say, "Hey, this is what happened. Here's what I need." And we're happy to be there for
Right.
both opportunities.
And then can you also touch on just not only partnerships, but how you've partnered with other businesses for the success of CDRx?
So we're seeing all these functional health, longevity, med spas, clinics, to all different shapes and sizes pop up,
Mm,
especially here in South Florida.
right.
I think, I was talking to somebody the other day out of state and they're like, "Yeah, I think we have three." I'm like, "I think I have three on my block."
Yeah,
I could walk
exactly.
to three.
Right.
Um, but what's amazing is those relationships, we as a pharmacy are able to really understand where the provider wants to take the patient.
Mm.
And then we're able to take it from a medication therapy standpoint, and we're able to have these great conversations. I have 5 pharmacists on staff. They're
Wow.
talking to doctors all day, every day. They all have different backgrounds. And we are really striving to keep our patients happy, healthy, horny, and skinny.
I
Like,
love it. I love
it's
that
such a funny
saying.
thing, and we get a lot of
Yes.
giggles, and it makes everybody smile. But really, truly, like a happy, healthy patient is a happy, healthy doctor. And the doctors call us time and time again, and they're like, "Thank you so much for making that so easy for my patient."
No, that's so good. So, the Chamber's Healthcare Council has grown into a truly dynamic program thanks to you and the team. So, from your perspective, what excites you the most about 2026 programming?
I think it's the conversations that we're having and
Mm.
and who we're having these conversations with.
And there's
They're
only 4. There's
right.
only 4 per year.
But the quality
Mhm.
is unimaginable. I mean, we're having the conversations we all wanna be having, but you only have a limited amount of time with your physician.
Right.
And so but there's so much to talk about, and the great thing about the council is that we're able to take kind of all of that and we say, "Okay, here are the top 10 things we need to drive home
Right.
in this meeting," and we hit them all.
Well, that's so good. And then what value do you hope it brings to the community?
I'm really looking to educate. I think that there's so much in question.
Right.
We have so many resources. I mean, we call it Dr. TikTok. It's
That's so
inevitable.
great.
It's what is going to happen, but it's just like anything. Just because you heard it on the internet doesn't mean it's true.
Right.
And so I really want this to be a resource for everybody, not just those in the healthcare profession, not just those that are maybe struggling with their own or maybe a family member struggling with their
Mm,
health. I want everybody to see this as a resource and there's something that you're going to learn from it and take away. Maybe you're not going to use it in that moment,
right.
but it's kind of going to resonate in the back of your head and you'll find yourself having that conversation in 6 months.
Well, I'll just touch on this. Even last year with some we had a smaller events, but they're growing now because we're running out of space, which is always a good problem to have. But I noticed that there were people in the room who were in the field working professionally, but then there were others who were just interested. So I think that our messaging, and especially with your leadership with the co-chairs, is really focusing on all people coming to learn about this.
We have to think, I mean, when you ask people what they want,
Right.
what's their birthday wish? They want to be healthy.
Yeah.
Like health, you cannot, it's invaluable. I
Right.
mean, we had this mindset go back 20, 30, 40, 50 years ago
Yeah.
where I'll deal with it when it happens. And now that's not, now it's such a proactive mentality,
Right.
which is fabulous because we're seeing longer lives. But not only are we seeing a longer lifespan, we're seeing a better quality of life. And
Right.
that has people interested. And there's no right or wrong time to start. And I think that that's what has kind of those individuals that maybe would never step forward before and
Right.
attend
Something like this.
some.
Yeah.
Now they are. They're like, "Hey, I don't have a question. I'm not there yet,
Right.
but I just am gathering information." And to me, that's like so inspiring.
No, that is. Okay, really quick. Many people find healthcare systems overwhelming, like the whole thing. What practical advice do you give patients to help them better advocate for themselves?
So no two patients are alike. I can
Okay.
tell you that. And you have to listen to yourself. So I personally had an experience over a year and a half ago,
Mm.
and I had a doctor telling me everything's fine. This is totally normal. It's because of your age. And at the end of the day, we know our bodies and we
Right.
know when something's wrong. you can always go for a second opinion.
Second opinions aren't bad, by the way. So let's
Opinions are
break that myth.
amazing. Second opinions are great.
Right.
But then also reach out, ask a friend, talk to a family member, but really put yourself in the driver position. This is your life. This is your life and this is your health. And there's nothing you're going to regret doing
Right.
to keep yourself healthy and active. So, you know, yes, it can be a very troublesome, it can be hard to navigate, but let me tell you, I have seen horrible, horrible patients. I mean, they are just,
Right.
it's, they're really down and they have found great practitioners and great resources and they've built this community around themselves
Yeah.
and they've overcome whatever healthcare issue they had and they're thriving now. They're doing better than they ever did. I have a 62-year-old woman right now who 5 years ago, they told her she wasn't going to be here.
Oh.
And she walks in the pharmacy. She looks like she's 48 years old. She is absolutely stunning. She has more energy than you and I combined. And she's living her best life. She's gone back to school. She's teaching yoga. Like she's doing all the things she wanted to do. Meanwhile, 5 years ago, she was literally like planning her funeral.
Right.
So find your doctor. Be comfortable. Find a team of doctors. It's more than one.
Right.
And just listen to yourself because you know.
Oh, that's so good. Well, so we're going to close out the show, but I have my rapid fire questions.
Ooh.
So just the first thing that comes to your mind, okay?
Perfect.
What are you watching right now? Any binge-worthy shows?
I am the worst. I do not watch TV.
That's okay. That's good. That's an answer.
So I'm probably right now with my kids, we're like we're binging Christmas movies.
Okay. That's perfect and very timely.
Yeah.
What's one book that changed your life?
Oh my gosh, one. So I don't watch TV, but I am a reader.
Yeah.
So I can tell you there's an amazing book. It's called Present Over Perfect. And I read it every year.
Every year?
Every year I read it because I take away something different every year. And it speaks to women and working and balance and life and relationships and friendships and marriages and motherhood and all the things.
Yeah.
And you just realize that you have to be present. Not everything has to be perfect. And I, for so long, wanted everything to be perfect.
Yeah.
And I feel like it's helped me
I need to get this
let
book.
go of that.
I need to get this book.
I know what you're getting for Christmas.
So I always give a book usually to all my girlfriends, and
Yes.
I have one book that I always gift, but I might have to change it now after I read this
It's
book.
so good.
So, what's your go-to coffee order to start the day?
Oh my gosh, a latte.
Latte? I like it. Just a latte.
That's it. Like we
so
got to keep
good.
it simple.
Thank you. Favorite Palm Beach hidden gem?
Ooh, restaurants
It could
or
be
just
anything.
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 Oh my goodness, hidden gem. I don't know how hidden it is.
I should be like the breakers.
Oh my gosh. A hidden gem.
Or just like a place that you love that you're like, I go to this spot every time I'm on the island.
So I'll say Palm Beach Grill. It was my husband's and
So
I first date.
Oh,
It's totally, I feel like everybody knows and talks about it.
yeah.
But just become a staple there and it's amazing.
That's so good. That's a good memory. What's one piece of advice you'd give to women or anyone who aspires to make a meaningful impact in their career?
Oh my gosh, we could have another podcast about this.
I know, right?
Don't give up.
Don't give up.
Don't give up. Don't let anybody tell you you can't do it.
Oh, that's so good. And last question, if you could have dinner with any historical figure, living or deceased, who would it be?
I would have to say Jackie Kennedy.
Oh,
I think
nice.
that just kind of what she did for her family, what she did for the country, what she did for women. I love kind of reading stories about her through motherhood. I just think she's just this quintessential American woman.
Oh, I love it. Well, Krysta, thank you.
Thank you. This was great.